in all countries, there are unrecognized cases that are not being picked up by current surveillance strategies, that are not being picked up by current testing strategies. And while Africa has done an incredible job of building and increasing and expanding testing capacity to be able to detect COVID-19 cases, it isn't evenly distributed throughout the entire continent. And so I think there may be unrecognized cases that way. There's also demographic differences where you have younger populations. Median age of a population is younger than some countries, perhaps in Europe, in North America. And you have different prevalences of underlying conditions, which put people who are infected with the SARS-CoV virus at a higher risk of developing severe disease, therefore possibly being detected by the health system. And I think there's a number of factors there. And I think in the beginning of this pandemic, we were asked this question a lot of why aren't we seeing so many cases in this country or that country? So it's a combination of factors. I think one of the things that I find quite interesting are the results from the early seroepidemiologic studies. There's a variety of them, a large number of them that are happening across the globe, more than 100 at present. And some of the early results in Africa are suggesting that there are people who have detected antibodies, meaning that they have been infected, but they were unrecognized. They weren't picked up by the current system. And so I think we also need to look at that data as well. And perhaps they didn't develop a severe disease, or they didn't develop a disease and therefore weren't picked up. So as Mike has said, it's a number of factors that are largely contributing to why we see differences in testing and differences in detection across countries.
Thank you very much, Dr. Ryan and Dr. Van Kerkhove. The next question is from Bianca Rotier from Il Globo, Brazil. Bianca, can you unmute yourself and ask your question?
Thanks a lot, Margaret, for taking my question here. Yeah, Bianca, I'm correspondent in Switzerland for Globo News and Globo, the largest TV network in Brazil. And China, my question is about China that announced today that chicken wings imported from Brazil tested positive for COVID-19. So what should be done in a situation like this? Can we get infected by the virus from food, including frozen food? What are the risks? What are the recommendations for consumers, people that work in transportation of food and also in production and packaging, and of course to companies and governments as well? Thanks a lot.
So thanks for the question. I can start, and maybe Mike, you would like to supplement. So yes, we are aware of the reports of these tests. What we understand is that China is testing on packaging. They're looking for the virus on packaging, and they've tested a few 100,000 samples of looking on packaging and have found very, very few, less than 10 positive in doing that. We have issued guidance with FAO on food handlers and working with food, working with frozen foods, working with live foods to keep people safe in their working environment. We know that the virus can remain on surfaces for some time, but the virus can be inactivated on your hands if you wash your hands or use an alcohol-based rub. And if the virus is actually in food, and we have no examples of where this virus has been transmitted as a foodborne, whereas someone has consumed a food product, the viruses can be killed, like other viruses as well, can be killed if the meat is cooked. So we have issued guidance on how to ensure that people who are handling these products can work safely.
And may I just add, because I think people are already scared enough and fearful enough in the COVID pandemic, it's important then that we track findings like this, and it's important that we don't discount scientific evidence where we find it. But it's also important that people can go about their daily lives without fear. People should not fear food or food packaging or the processing or delivery of food. Food is very important, and I would hate to think that we would create an impression that there's a problem with our food or there's a problem with our food chains. They're under enough pressure as it is already. We will continue to track findings like this, but as Maria said, there is no evidence that food or the food chain is participating in transmission of this virus, and people should feel comfortable and feel safe in the now. There are many other reasons why we need to protect and we need to cook our food properly, and there are many other contaminants of food that occurs, but I think we should not be placing COVID as a risk in this area. I think it's important that we don't conflate observations like this into a major concern around food. Our food, from a COVID perspective, is safe, but there are many other reasons that we need to keep our food chain safe. And many people work very, very hard across the world to ensure that our food is of safe and of the highest quality.
And Dr. Van Kerkhove. The next question goes to Michael from CNN. Michael, can you unmute yourself and ask your question?
Good afternoon from Ottawa. This is Michael Bossack here. I'm a contributor to CNN Opinion. There's been a lot of talk, thank you for taking my question. There's been a lot of talk about the expected demand for the new vaccine, but as you know, anti-vaxxers have taken to social media in a big way. In fact, I'd say there's almost a virus of disinformation out there about the future vaccine. And according to a CNN poll in May, and this is quite shocking, about 1/3 of Americans said they would not get vaccinated against coronavirus, even if it were widely available and low cost. And then just quickly, I interviewed just now the head of Rotary International, John Halko, and he said one of the end games of COVID crisis will be vaccinations and that there will be resistance. However, there's a lot to learn from polio in terms of how to overcome the resistance. So my question is, what needs to be done? Have governments underestimated the degree of resistance, and is it too late to counter that effectively? Thank you.
Thank you for the question, because it's absolutely important